In a little while, you'll be taking your bundle of joy home, and you may have questions if problems arise. Hi there, I'm Dr. Richards. I am a pediatrician who specializes in newborn babies. I am the medical director of Children's Services here at TMC for Children. I would like to talk to you today about newborn warning signs. One of the most important things I talk about with families is that a baby should eat every 3 to 4 hours. If your infant shows no interest in feeding, within 5 hours, you should call your physician. This could be a pediatrician or your family medicine doctor. Another thing is when you're checking those diapers. A baby should have a wet diaper once for every day of age. But if your baby does not have a wet diaper in 12 hours, then you should call your physician also. Now, the stool is a different story. People are very concerned that if a baby doesn't have a stool or poop within 24 hours, that can be a problem. That's not really always the case. If your baby is sleeping well and eating well at feedings, and the poop or stool is very infrequent, it could be once a feeding, once a day, or even sometimes once a week for breastfed babies. That would be a normal pattern for your infant. Another concern is that within a day or two of going home, your infant may develop some yellow color of the skin. This is called jaundice. Now, 50% of all babies develop some jaundice, but jaundice can become severe. If you see the yellow color of the skin, go to the hips or to the knees. Or if the whites of the eyes develop yellow color, then you should call your physician about that. Because if this gets too high, it can actually cause some developmental delays. The last thing I talk about is temperature and your baby feeling warm. Now, you have been holding your baby for a while. You know what the feeling of the temperature of the skin is. If your baby starts to feel warm, the first thing to think about is how wrapped are they? Do you have 2 blankets on a baby when it's 100 degrees outside? My general rule is that infants only need 1 more layer of covering more than what you are wearing. So if you're wearing a t-shirt, baby only needs a t-shirt and a single blanket. If taking those blankets off, the baby still feels warm, then you should take the baby's temperature, and the best way to do that is in the baby's bottom. If the temperature is above 100.5, you should call your physician. If they do not call you back within an hour, you should go to the emergency department. A baby can't tell us if they're sick, and a fever can often be the only early sign of a severe illness. But with all that, I hope you're having fun with your baby.